Great, thank you. Hello, and welcome to the Iowa Ideas Conference session on Iowa's weight gain. I am your moderator, Dacey Waldron. I am a wellness coach with MercyCare Business Health Solutions. We are very happy that you have joined us. This session is within the healthcare track of sessions, and we want to give notice to one of the sponsors, UIHC. So we have a video that we're going to watch.
Welcome to the Iowa Ideas Conference. I am Kimberly Hunter, Interim CEO and Interim Associate Vice President of the University of Iowa Hospitals and Clinics. The COVID pandemic brought about exceptional challenges, such as worker shortages and healthcare disparities that really have changed the way we view healthcare. However, it has also highlighted opportunities for innovation and improvement. For example, we have seen a move towards telehealth, which helps us provide better access to care for all Iowans. We know that healthcare excellence is achieved through innovation and collaboration. And that is why we are a proud sponsor of this conference, and we are excited to hear your big ideas on how we can come together to improve quality of life and quality of care in Iowa. On behalf of the University of Iowa Healthcare, we hope you enjoy the conversations, make some great new connections, and leave inspired to help us shape the future of healthcare. Thank you.
Thank you, UIHC. Just a couple housekeeping items here. Closed captioning is available, and this session is being recorded for later viewing. You can also submit questions in the Q&A section at the right. So in this session, we are looking at how obesity, weight gain has been on the rise for decades in Iowa, and especially since the start of the pandemic. So we're going to look at what the state is, what the severity is of this diagnosis here in Iowa, and how this trend is having an impact on health-related resources, and what we can do about it. So our time together will include talking with our panelists and addressing audience questions. Right now, I would like to go ahead and welcome our panelists and have them introduce themselves, who they work with, and what type of connection they have to our session topic today. So Dara, if we could begin with you.
Hi, thank you so much, Dacey. My name is Dara Lieberman. I'm the Director of Government Relations at Trust for America's Health. We're a nonprofit, nonpartisan public health policy research and advocacy organization. And we've been researching the obesity trend for the past 2 decades and making policy recommendations to try to address some of those challenges. I'm happy to be here today.
Thank you. How about you, Dr. Kruse?
Oh, good afternoon. Thank you, Dacey. My name is Dr. Robert Kruse. I'm the State Medical Director for Iowa in the newly aligned Department of Health and Human Services. And as a fellow of the American Academy of Family Physicians and a state medical director, I have both a clinical perspective in working in patient care as well as statewide population health perspectives as well. This is my 5th day on the job here in my new role. So thank you again for having me and inviting me to the panel here.
Thank you. Jami.
Good afternoon, and thanks, Dacey, for having me. Jami Haberl. I'm the Executive Director at the Iowa Healthiest State Initiative. We're a nonprofit organization working to improve the physical, social, and emotional well-being, and was started by the business community. And so obviously recognizing that obesity has a significant impact on workforce as well as healthcare costs. That's really our tie back to obesity and really wanting to help improve the lives of all Iowans. So excited to be here.
Thank you. And Cindy.
Hi, all. Thank you for having me. My name is Cindy Fiester. I am the Chronic Disease Services Coordinator at Linn County Public Health. I work in a very specialized division of Linn County Public Health called the Assessment and Health Promotion Branch. And within that branch, we are responsible for conducting and writing and doing outreach and provisioning our community with what they need to address top issues in our community health assessment and community health improvement plan. And obesity is just one of the 3 top issues for Linn County. And so that's why I'm here.
And we just have a fantastic panel. I think we're getting the local, the state, and the national level here. So Dara, if we could begin with you, because you have data. You have current data you could talk to about obesity rates in Iowa, maybe how it compares to the nation, what it is recently, what it's been in the last few decades? How has it been changing? Can you give us what that trend is?
Yeah, so just a couple weeks ago, my organization TIFA released our latest in our annual State of Obesity report. And we found that Iowa has an adult obesity rate over 36%, which puts them at about the 11th highest rate in the country. And keep in mind that 2 decades ago, no state even had obesity rates over 35%. So really in less than a generation, we've completely flipped. 10 years ago, for example, Iowa's obesity rate was around 29%, and 20 years ago it was about 24%. No state even had obesity over 25% in 2003. So the fact that we've had that significant of a shift, both in Iowa and nationwide, is concerning because of the related health impacts of the diagnosis.
Mm-hmm. Thank you so much. So, Dr. Kruse, we see the weight gain trend here then, 1 in 3 Iowans in that obesity range. But, why should we be concerned about this? Like from a medical perspective, what are maybe the health risks or diseases associated? What are the health costs that could be associated?
Sure, yeah. So people who have obesity, both adults and children, when compared to those who have healthy weight, are at an increased risk for serious diseases and health conditions. I think a lot of people think of diabetes and hypertension, but it's much more. It's coronary heart disease or artery disease, strokes, gallbladder disease, osteoarthritis, sleep apnea, breathing issues, with that, as well as many types of different cancer, and mental illness such as clinical depression, anxiety, and other mental disorders have been linked. As well, from like a cost perspective or physical perspective, individuals with obesity have had substantially higher medical costs than healthy weighted individuals. And there's a study, I believe, in 2021, and found that obesity kind of accounted for about 170 billion higher medical costs annually in the U.S. And these are actually direct costs that are associated as a result from inpatient, outpatient type services and therapies. And separate from this, there's also indirect costs. So non-medical costs from obesity, such as school, missed work from time for school, missed work time, lower productivity, premature mortality, increased transportation costs. So this really emphasizes the need for preventive strategies to really reduce these health risks and costs associated with obesity.
Mm-hmm. And most of us probably have experienced weight gain at some point, and the causes. It could be anything from moving less, eating more, eating less nutritious food, certain medications. At the local and state levels, then, what phenomena are you all seeing, in regards to health needs or resources that are being utilized more often, or resources that are needed that are associated with weight gain or obesity? Cindy, why don't we start at the local level with you?
Sure. So in recent years, actually, I should back up a little bit. So since 2005, our community health assessment and community health improvement process has always had obesity listed as one of our central focus areas for each iteration of our community health improvement plan. So these are written every 3 years in conjunction with our health system partners, and they really are kind of our North Star for what we need to work on locally. And since 2005, every time we've written this, obesity has been a central focal point, rather through data and through our community's perception. Our community members want to work on this. And so what we see, though, more recently is we are in line, as Dara mentioned, with national trends. This is going up rather than going down. But what we're trying to do here locally is make sure that we get away from writing a goal for our community health improvement plan that is something to the tune of we are going to reduce obesity by X% over the next couple of years, so that we can truly focus on the things that we believe our community should focus on in order to address this epidemic. So there are 2 focus areas to what we're going to be doing. One is really related to access to food, nutritious food, making sure that people have that addressed as one of the social determinants of health that impact, weight gain, overall health. It's food insecurity at the core, because oftentimes hunger doesn't look like what we think it looks like. In maybe past depictions of people, hunger and ineffective nutrition looks different these days. So food access is one of our key points. The second one, and this is all very much in line with the White House Conference on Nutrition and Food Security recently, is that we focus on equitable access to physical activity so that all of our community members, young and old and in between, have equal opportunity to be physically active as they wish, safely in the community. So that's kind of what we're seeing. We saw really some unprecedented need for food during the pandemic when many people lost jobs. And so there's just kind of been this ripple effect, I think. So, but I'll let somebody else speak for a little bit.
And I know too, like one of the problems I've seen in wellness coaching is that people have a hard time getting access to fresh fruits and vegetables. Now, Jami, can you give us kind of what you're seeing? Because I know there's a connection there with fresh fruits and vegetables, that you have a program that the state of Iowa, Healthiest State of Iowa initiative kind of works with.
Yeah, so we know that nutrition insecurity is a major challenge. And obviously, if you don't have access to those nutritious items, such as fruits and vegetables, to be in your diet. And oftentimes those individuals, I would say in Iowa, we've actually ranked anywhere from 48th to 50th in the nation for consumption of fresh fruits and vegetables in general. And so I think most people are surprised at that. But if you travel the state and you recognize that, many Iowans probably are eating more potatoes and corn, not to say that those are unhealthy, but they're not eating some of those other very nutritious fruits and vegetables that they should be consuming. And so we know access is a major challenge, and especially access for those that maybe have financial barriers or low income Iowans definitely don't have access. And they often are also part of the Medicaid system. And so one of the programs that we provide across the state of Iowa in partnership with farmers markets and Iowa-based grocery stores is our Double Up Food Bucks program. And this is really working to increase access for those low-income Iowans who don't have access to those fresh produce so that they can continue to add healthier foods into their diets, and hopefully over time start to see some of those reductions of those chronic health conditions, or even just maintaining and trying to improve some of those chronic health conditions, whether it's obesity or some of the other chronic conditions that Dr. Kruse even talked about. So I think those are, types of programs that are helping to support people. Another program that we are new to is a produce prescription program. And again, that's a similar type of concept as how do we actually prescribe healthy foods to individuals and then provide that access so that they can incorporate more fresh fruits and vegetables into their diet, and really diversify the nutritional content that they have within their diet as well.
Thank you. So Dr. Kruse, I know you're 5 days into the job here, but from your medical perspective, what have you seen maybe over the last 2 years, things that have increased costs?
Yeah, well, I think, certainly, adults with excessive weight gain are at greater risk during the COVID-19 pandemic, as obesity may triple the risk for hospitalization due to COVID-19 infections, and it's been linked to impaired immune function. So there's a lot of things that have been kind of linked with obesity and having worse outcomes during COVID-19 or having COVID-19 disease. So increased risk for hospitalization, intensive care unit admissions, invasive mechanical ventilation, and death were higher with increasing BMIs. So I think it points out, obesity is just a complex disease. There's many contributing factors, neighborhood design, access to healthy, affordable foods and beverages, as that's been said, access to safe and convenient places for physical activity. It's easy for a provider to prescribe that, but sometimes there can be barriers in the way. And part of our job in public health is to help reduce those barriers to be able to access some of this, more ably.
Mm-hmm. And Dr. Kruse, you have an occupational health background, if I'm correct with that. Yeah.
Correct.
So in that practice, I'm just curious, I would imagine people coming to see you, some of those workers getting injured on the job, it might be we're moving less on the job, muscles getting tighter, weaker. I'm guessing some of the, which, then I'm moving less, my weight increases. That contributes to more joint issues as well too. Did you see that in that practice? Am I kind of on that right?
Yeah, absolutely. So I've been medical director, of occupational health there, Mercy One, for the last 4 years prior to this position, and really, when we look at workers, especially ones that are more physical in type of labor, some of the adaptions that have to be made on the workplace, whether it's ergonomics or whether it's just overall ability to function to do the job, can be substantially more difficult to be able to do that. I think also a big physical cost or cost for this in the U.S. military. I think it's one of the leading causes of obesity is one of the leading causes to not be able to function or perform in a military standpoint or readiness. So I think there's multiple capacities that obesity can influence people to be able to do their job or function at their job sites too, and increase the risk for possible injury on the job as well.
Mm-hmm. So it's clearly impacting us here in Iowa, locally and at state level. So what can we do about it? I know each of you might have suggestions and ideas of what we can do about it. Dara, from a national perspective, or what's a suggestion or suggestions that you might have? What can we do about this?
Well, I certainly want to echo my colleagues on the need for increased investment in food security programs. Like my organization calls for healthy school meals for all children. In addition to the educational benefits and just the mental health benefits of kids having a full stomach, it is one of the healthier sources of food for a lot of kids who are low income and near low income. So there's no reason why we shouldn't be able to feed all of our children every day. My organization also points out that there's a real wide mismatch in the costs of obesity and how much we're actually investing in preventing it. We'll spend billions of dollars on treating obesity, but just pennies on the dollar on preventing it. So for example, CDC has a program that invests in state physical activity and nutrition programs, but it only has enough funding for 16 states, and Iowa's not one of them. And remember, I said Iowa had the 11th highest rate. So we're not even able to put our money where it's needed most in a lot of areas.
Wow. Is there something we can do about that?
Well, I would certainly encourage everyone to communicate with their policymakers, and that's at the local level, calling on your schools to make sure that all kids have healthy school meals. It's calling on zoning boards for walkable and communities and access to active transportation, but it's also calling your members of Congress at the national level. And it's really easy that you can just, it's very easy to send an email to your senator or congressman and say, we need to invest in CDC's obesity program, CDC's chronic disease prevention program, so that we can have money in Iowa to address this problem.
Thank you. Thank you. Cindy, how about you? Suggestions, what we can do, what we need?
Well, I echo everything that Dara just said, and I would highly suggest, and I know Jami will say this too, but Jami's office, the Healthiest State Initiative, has some really awesome campaigns. And I won't steal her thunder, but we like to promote those at the local level because they are very easy to engage in and very easy to follow along with. But we do invite any member of our community who is interested to contact Linn County Public Health, and I can put our contact information in the chat, because the Community Health Improvement Plan process includes members of our public. So we have work groups around many of the big items that we work on. One is obesity, but we also have working groups around mental health, around community safety, around safe and affordable housing. And the only way that we can get work done is by partnering with our community members. So we welcome interested individuals to join in our Community Health Improvement Plan work. And we would love to have people attend meetings and help with some of these little P and big P, so little policy or local policy, and bigger, more national or state policy issues that we work on in regard to ensuring access to fresh fruits, vegetables, enough food for people just to survive in general and have a good, adequate diet. We also want to ensure people join us in some of our more recent efforts as far as access to physical activity, equitable physical activity opportunities. And there are ways for the public to get involved if they just contact us. We will welcome them. So
emailing you as opposed to going to the website.
you can go to the website and you'll find the same email that I'm going to put into the chat. But
well, let's say that I don't live in Linn County. I live in another county. Do you have suggestions for how either I can find out about resources or ways I can help or what we can do, or maybe there's not anything, who I would suggest or ask, how do I help get something started?
I don't know if that question's directed to me or to
sorry,
Jami.
Cindy, you. Yeah, Cindy, if I'm another county, we obviously Linn County have a robust program. What if I live in a county that doesn't?
So we can connect people to their local contacts. A lot of communities do have groups that work on this very topic. The thing is like Dara alluded to earlier, there's so little funding around this. It's not that you're going to find a flashy billboard or a sign outside of an organization, like a business, to lure people into getting involved in this. This is all grassroots stuff largely, but I'm gonna let Jami speak to some of the ways to get involved because she has some really cool stuff that people could engage in.
Yes, Jami, can you tell us about initiatives or things that you have through the state that we can get?
Yeah, well, and I think one of the things is to recognize that every county in our state, all 99 counties, do have a local public health agency. Yep. They may all look different. Not all of them are going to look like Linn County. So not to steal Dr. Kruse's comments, even from the state, but that is one way, and you can get involved in that way. I think the other things, so one of the campaigns that Cindy was referring to is our 5210 Healthy Choices Count campaign. And so this is a campaign that is really an evidence-based framework around how to have healthy choices within our schools, our early care, our out of schools, as well as within our workplaces and our communities, and connecting with healthcare providers. So it includes not only a message around 5 or more fruits and vegetables a day, 2 hours or less of recreational screen time, 1 hour of physical activity, and 0 sugary drinks, drink more water, but also around some of those policies that can be implemented maybe in your school. So you could be really an advocate for your kids or kids within your community and be engaged at the school level to maybe have some policies that are implemented so that it is building those healthy habits within our kids today that will support them as they move into adulthood. And so we have a lot of different free resources that are available that we often tell people to beg, borrow, and steal. And it's really meant for individual Iowans, but then also those different sectors on what that they can do to actually play a role in improving the health of whatever audience they might be directly working with as well.
Thank you. Dr. Kruse, suggestions?
Yeah, I think I would echo, that there's different levels of engagement at an individual level, local level, different levels of programming, state level, federal level, national level. With the new kind of Health and Human Service Agency alignment, there's opportunities for Health and Human Services to better coordinate data collection analysis to understand really the challenges that are facing Iowa families and really help to target nutrition and physical activity, programming to support those Iowa families. And so, help them to make those kind of healthier choices. One example, the Supplemental Nutrition Assistance Program, SNAP, provides nutrition benefits to supplement the food budget of needy families so they can really purchase that healthy food and move towards self-sufficiency. So we need to make it easier for everyone to move more, eat a healthier diet where they live, learn, work and play, and just basically where people are engaged with that and where we can have those opportunities. So together, community, states, and our federal partners, we want to work to remove those barriers to promote health for all. So.
Mm-hmm. Thank you. So this is a big idea session, which means that the attendees giving us questions, giving us your input, your insight, having a conversation with you all is part of this big ideas session. So please go ahead. You can put your questions in the Q&A section. I have a couple that we have here, and so if we can maybe address those. And just commenting for a moment at the school level, the education behind this to begin with. If you don't know what nutritious is or what your body needs, that's a huge obstacle. And I know from having nieces and nephews that they are doing more in schools to try to teach healthy eating at the elementary school level and what that looks like. So that first and primary to do some education. One question we have here is that it's such a complicated issue. So where do we start? Do we do more recreation? Do we, build more parks? Do we find better access to food? Do we have a better understanding of quality of food? I don't know if anybody could speak to any of those questions.
Yeah, I think it's a combination. I think, it's not just one answer, it's complex, right? So we want to make sure there's access to those healthier foods. We need to design communities that connect, sidewalks, bike routes, public transportation with homes and early care education settings, and schools and parks. And so it's not just one single answer, for that. It's complex. And so we have the answer is going to be complex as well, to solve it and comprehensive.
Mm-hmm.
And I think a lot of it also comes back to our culture. I think is really important as we start to look at policy implementation, even how do we start to provide a culture that then allows your employees to take a walk during the day or allow kids to be more active during the day. So you can build all kinds of trails and parks, but if we don't build a culture to use those and take advantage, we have an amazing trail system in the state of Iowa, and we actually have a ton of parks in the state of Iowa between our city, county, and state parks, but they're probably underutilized, right? And so those are free resources that people can use to get outside and be active, but it's not really part of our culture to use them as much as it is some other cultures across the United States. And so how do we start to build that into our culture and make it okay to actually, be more active, especially during the winter months? We tend to hibernate a lot in the state of Iowa, but if you look to our friends to the north in Minnesota, they do not have a problem getting out and being active in the winter months. So how do we embed that in our culture, and how do we start leading by example within whatever organization that you work for, that you can be that, that push to actually start to build that culture within our communities so that it's okay for people to actually normalize being much more active. And it doesn't have to be that you're a marathon runner or a triathlete. I think it's always even just as simple as being able to take those walks, taking those first steps, I think is super critically important.
What about what you've noticed either personally or with interactions you've had with people? How has the pandemic increased the likelihood of weight gain in individuals? What kind of things are you seeing and hearing? I know I'm seeing and hearing as a wellness coach a lot of things. What are you seeing and hearing? Anyone can, it's addressed to anyone.
I think as the pandemic kind of started, people were very fearful sometimes to even be outside and do some interaction, and rightfully so. But we had a lot of traditional means of exercise and interaction closed down, and so people needed to kind of figure out some different ways to get out and about. But we've also seen some, like I alluded to earlier, we've seen some unprecedented need for food with very long lines when we've had food pickups, I guess, if you will, for lack of a better, just food distribution days. The lines have been unbelievable as food boxes have been handed out. And so I think that says a lot to maybe some economic insecurity and some other issues that may be impacting people's just overall well-being and access to maybe what they had access to before and things of that nature. So
I feel like there was a combination, right? Some people I've heard, they really focused on their health and were really successful in kind of having the time to dedicate doing, maybe more physical activity and really honing in on what they were eating. But then I think there's been a lot of people who actually went the opposite direction, and it was using food as comfort, or if you didn't have access to a lot of food, using the food that was available, like Cindy is talking about, and having to wait long time in long lines just for getting access to food. And then how did you ration that throughout the week or until the next food opportunity even became available for people? And then, even in my own neighborhood, I started to see more of my neighbors actually walking during the height of COVID, and I don't see them doing as much now, which is also kind of interesting, right? So I think there was kind of a mix, and it probably depended on what your economic situation was, what your job situation was as well, because we had a number of people that still were frontline workers that didn't have that same flexibility to be working from home, that had significantly increased amount of stress, which then can also lead to, and we've seen an increase in substance use in our state. And so leading to some of those maybe not so healthy habits, which also then can lead to obesity and other chronic health conditions.
What I've heard too is that we had so many people who started working from home, and literally the number of steps it takes to go to the bathroom is like 5. And during the workday, in an office, you'd be, have to walk more than 5 steps to use the restroom, and then you'd stop and talk to somebody. And I know, Jami, you made alluded to the stress levels. One of our questions here is if Iowa ranks pretty poorly nationally when it comes to mental health care. Any connection between our mental health and weight gain?
Yeah, I would say there is a connection. I think with increasing BMI, where we can see that, and poor worse health outcomes. I think during the pandemic, we also kind of piggyback on the last question. A lot of people are disengaged with their clinical providers, coming from a clinical perspective. And so there's usually a health education piece that can be given, either anticipatory guidance or things to watch for. There's less screening that happens at that area, for children or adults who may have obesity. And so that health education component was kind of lacking, not necessarily lacking, but less disengaged, I should say, sometimes from a clinical perspective.
And I definitely think, there's more and more research around the food and mood connections. And if you think about the last couple of years, our social connections changed drastically. And I think we're still struggling to figure out how do we have those social connections? What does that look like? And that definitely impacts your mental health and mental well-being, right? But then even just that physical, it's all combined, right? It's your whole being. And so we're definitely, I think, seeing some of the other side of coming off of living through a pandemic, the physical challenges, but then also the mental challenges that our society is having to, unfortunately, work through after living through a global pandemic.
Mm-hmm. I know I would hear people talking about how they were baking more. Jami, you mentioned how we have more alcohol being imbibed during this time. Both of those have high number of calories that are very little or no nutrition at all in them. That's got to contribute, with the lack of movement, to contribute to an increase in weight gain as well too. We have another question here on one of the major consequences is the rise of diabetes with weight gain and obesity, and a need for low cost and affordable insulin. So additionally, the impacts on diabetes and pregnancy is dangerous, and on the rise too. Can anyone weigh in on that? Obesity, insulin, need for insulin, or?
So before the pandemic, our community had a state innovation model grant. And with that, we launched something called My Care Community. And that initiative really helps health and human service providers locally to focus on the whole person, everything that happens outside of the medical system for the most part. So the social determinants of health. And one of the focus areas of that state innovation model grant was on diabetes, and particularly the prevention of type 2 diabetes. And there was a fairly robust program in place. Now, COVID really put a damper on it, because a part of this program that I'm about to kind of explain to you was related to in-person class sessions and then a gym membership for individuals. And that program was through our local YMCA, but it's hosted in a variety of settings across the nation. But it's the Diabetes Prevention Program. It is a CDC sanctioned program. Again, something that's highly underfunded. There is a cost to it for the participant, but there is a cohort of individuals that would go through this group together, and they would take classes together, and then have, through our YMCA, a gym membership would be part of their experience. And so that program actually has evidence-based outcomes in kind of reversing the trend for the participants toward developing type 2 diabetes. Individuals that participate in that would have to have what was called a pre-diabetes diagnosis. And so what we find is that programs like that do work really well, but it's hard for people to afford that. There's no Medicaid coverage for that particular program. It has been some movement, but it's extremely complicated for the provider to get paid under the Medicare program. But there are a lot of roadblocks in the way for people to use benefits that they may have available to them on wellness, rather than when they get to the other end of the spectrum and need treatment. But again, we do see this nationwide push that needs to happen to lower the cost of insulin access. But we also hope, from the public health lens, that we can have affordability around any of the programs that are, clinically validated, that can help people live healthy and safe in the community. And we don't see a lot of that. There's not that front end investment in prevention. So,
and there is more prevention being taken. I know from working with companies, they're kind of seeing this, like, we need to try to prevent these health issues from occurring. It's less expensive for us as a company, for workers, like being in the office, and for just healthcare costs. So it is moving, but the needle isn't moving as fast as we would like it to prevent the trend from going up. Now we have about 2 minutes left, and I just want to give everybody the opportunity for a last comment, a suggestion, whatever final comment might be. Dara, do you have a final comment, or could you give us something?
Yeah, I mean, I hope people take away that none of this conversation is about stigmatizing the individual. This is really just trying to make healthy choices as easy as possible for people. And those healthy options are not equally available for everyone, especially for people in lower income brackets. So I encourage folks to check out our report at tfah.org and take a look at some of the policy recommendations that we make to try to move the needle.
Great, thank you. How about you, Dr. Kruse?
I'd say, obesity prevention is clearly an issue in which public health has a vital role. State public health agencies have important roles in obesity prevention. They provide leadership, coordination among state level entities, bridging between local and national efforts, technical and financial assistance, dissemination of what works via provision of best practices and resources. And so I think it's also important to note that it's a complex disease, and so we need to approach it from a comprehensive standpoint. And it's about kind of engagement at a local level, an individual level, a state level, and national level together, to try and kind of reduce the onset of obesity, I should say.
How about you, Jami?
Yeah, I would echo what everyone else said. I think, getting involved at whatever level you're comfortable at to have these conversations is going to take all of us. I often say, our vision is that Iowa does become the healthiest state in the nation. Well, that's not about just Iowa Healthiest State doing this. It takes each and every Iowan to, be part of that. And so figure out where you can fit in, whether it's just focusing on your own personal health right now. Maybe it is just starting walking. We're all on this journey differently. And so find a way that you can be part of the solution, whether it's being involved in your local community, your school, or even at that national level. It's going to take all of us to really focus on the prevention side of it and starting to move that needle faster, as well as just a culture of focused on prevention as well.
Thank you. Cindy, do you have anything else to add?
Nope, just we welcome involvement. I echo everyone so far.
That's great. Well, thank you everyone for attending the session. Thank you to our panelists. We really appreciate the conversation. A reminder that the conference continues tomorrow with the featured keynote speaker, Michelle Shelton. Thank you.